Why does Medicare have to be so confusing? I hear that all day, every day, and I totally agree. With hundreds of options, commission-hungry sales agents, overpaying for premiums, deductibles, co-payments, co-insurance, drugs, and hardly getting any customer service can make Medicare really suck. I am Braden Mosley. I'm a licensed Medicare insurance broker. I work with Midwest Insurance Group. It's one of the most trusted brokerages in the Midwest. Today, I want to help you understand 95% of Medicare in a way that doesn't put you to sleep so that you can have a little more peace of mind when you approach the whole world of Medicare. So our agenda is going to be number one, a Medicare overview. Number two, supplements versus Advantage. This is one of the most common topics in Medicare. Number three, choosing the best option for you, because that's what this is all about anyway. And then finally, a free offer from me to help you take that next step and take care of your Medicare in a way that's less confusing and less of a hassle for you. So first of all, we're going to dive into a Medicare overview. So in 1965, President Lyndon B. Johnson signed Medicare into effect. This really just consisted of Part A and Part B. Part A is hospital and Part B is going to be medical. And since these two parts are around today, they make up what we call original Medicare, and you'll hear that term a lot. So just think Part A and Part B, and it's been around since it was signed in 1965. However, we realized that with original Medicare, there were gaps. Maybe not gaps like this, but pretty big gaps nonetheless. Original Medicare, Parts A and B, covers about 80% of your medical expenses. To give you a little background, original Medicare was only designed to be essential coverage to make sure that you weren't gonna die or be gravely ill. So for that reason, you're covering a 20% chunk of everything that's coming through, with the possibility of having massive procedures. Sometimes medical procedures can be in the hundreds of thousands, if not millions of dollars. 20% is a lot. Also, at the bottom here, this excludes drugs, dental, vision, hearing, over-the-counter, gym memberships, other things to help keep you healthy. So the government said to the private insurance companies, I want you to fill those gaps, because private insurance companies are very efficient when it comes to creating plans for people. So in 1992, supplements were made. A lot of times people call this Medigap. And those kind of work alongside original Medicare. And then about a decade later, in 2003, Medicare Advantage plans came out, which completely replace original Medicare. And it's kind of the privatized version of Medicare, where the private insurance company takes care of everything. And they often bundle in extra benefits to their plans. So that's Medicare overview. Now we're gonna dive into the supplements versus Advantage discussion. So we're gonna start with the nuts and bolts of how it works, and then we're gonna work into choosing the best plan for you. At age 65, Medicare becomes your primary insurance. At that time, you'll get Part A and Part B, and you'll get your little Medicare card in the mail. Since you've worked, you have paid into the Medicare system. So imagine Medicare sets aside some amount of money to facilitate your care when you retire. For easy numbers, let's just call this $1,000 a month that Medicare has set aside for you. You have two options. You have either the supplement route or the Advantage route. You could elect to just take original Medicare, just A and B, but those gaps, they could really tank you financially. So to fill those gaps, we're either gonna choose the supplement or Advantage route. Here's how the parts of Medicare kind of play into this. So on the left side, you have A, B, and then D, which is gonna be drug coverage. And then C is over on the Advantage side, because Part C is just another name for Medicare Advantage. Now there are three ways that you pay for your insurance. There's premiums, which is just a monthly or quarterly amount that you pay in order to keep your plan active. There's deductibles, which is an amount that you pay before your insurance actually kicks in. And then there's co-insurance and co-payments. Co-insurance is a percentage of a bill that you would pay. kind of like that 20% you cover from original Medicare. And co-payments is a set dollar amount that you pay for a service. So let's say you get a drug with a $10 copayment. Every time you get that drug, you'd pay $10. Starting on the supplement side, for Part A, you would pay a $0 premium, but you'd have a deductible of $1,600. This number can change yearly based on what the government sets. But then you would have co-insurance of 20%, as we mentioned before. Part B actually has a small premium. It's about $164.90. It has a deductible of $226. Again, these numbers can change yearly. You would also have co-insurance of 20%. Now, you would also have to add a drug plan, which would have a small premium and then also a deductible that's set each year by the government, and co-payments every time that you get the drug. So here's where the Medigap plan actually comes in play. So if you get a Medigap plan, also known as a supplement, it would be an extra premium, so anywhere from $100 to $200 based on the plan you choose and based on your age. But here is the powerful part of the supplement. It actually eliminates a lot of the co-insurance and the deductibles that kind of define the gaps of Medicare. So when you pay that extra premium, it's kind of like a subscription. You'll actually be eliminating a lot of the gaps. So you won't have to worry about those big 20% bills anymore, or even your big deductibles you'd have to hit before insurance kicks in. When you have claims, they would actually bill Medicare. So Medicare would use that allocated amount they have for you to pay for your claims. Now on the other side, when we move over to a Medicare Advantage plan, Medicare would actually throw that money that they've allocated for you over to the private insurance company. A lot of the time, there's $0 premium and $0 deductible for these plans. However, Advantage plans differ mainly in this co-payment section. Most of the time, they will have co-payments for doctor visits, specialist visits, hospital visits that you would just pay as you go, rather than paying kind of a monthly fee like they do in the supplement route. One thing to note here is that you still would pay your Part B premium of $164.5-ish, but these plans often bundle in drug coverage and other bonuses like dental, vision, hearing, over-the-counter, gym, mental health, and they all have a maximum out-of-pocket, which means whether the max out-of-pocket is $3,500 or $8,000, you cannot exceed that limit when you're paying all these co-pays. So a common question we get is, how can the Advantage plans, the private insurance companies, afford to give $0 premium, $0 deductible plans plus benefits? And there's two main reasons why. Number one is that Medicare pays them with the money that they have kind of allocated aside for your care. And then number two is that they reduce waste through co-payments, prior authorization, and networks. So they're actually paying a lot less in fraud, waste, and abuse than Medicare does through original Medicare. So now your big main question is, okay, Braden, so what do I do? So that's where we're gonna dive into finding the best option for you. And I have a little bit of a fun analogy to help you wrap your mind around this. So let's say you were gonna buy a boat and you were all excited to take it out for a spin in the lake, but you wanted to make sure there were gonna be no holes in the boat, because you don't wanna be sinking out there. So you'd have two options to address this concern. Number one would be getting a super sealer. This is a product that you would pay one time every year just to seal the boat. Another option would be a leak patch tape, which is just a really nice piece of tape that goes over a hole as needed. And it's only gonna be $50 per piece. So let's say you got the super sealer and you sealed the boat. You would know that there would be no holes in that thing, except you're gonna be paying that $3,000 every year to reseal it. On the other hand, if you use the leak patch tape, when a hole popped up, you would simply patch it as needed, and that would only be $50 per piece. So as you might be able to guess, not all boats are created equal. A raft, for example, that might be susceptible to a lot of leaks and holes, you might want to use that super sealer. However, a yacht that's made of aluminum and steel, you might want to go with the leak patch because you're pretty sure that there's not going to be holes in it anyway. But Captain Mosley, you say, I'm getting Medicare, not buying a boat. How does this help me choose between supplement and advantage? Overall, I like to tell people that the super sealer is kind of like the supplement, while the leak patch tape is like an advantage plan. And if you look at the boat as your body and the hole in the boat as an injury or an illness, and then the water that's filling the boat as medical bills, then the supplement plan is going to be very similar to the super sealer, while the advantage plan is a lot like the leak patch tape. So overall, to bring this back home, if you have tons of health issues, holes in the boat, you don't mind spending more money for the super sealer, you don't want to deal with networks at all, and you need a predictable budget that you know how much is going to come out every month, then you might want to supplement. But if you're generally healthy and you don't think you're going to have a lot of holes in your boat, you want to save money on average, and you want a ton of extra benefits that are bundled in with an advantage plan, and you understand how co-payments work, that when you actually go seek the service, you will have a small bill for that, you might want an advantage plan. Now, I know that this is a lot of information and you still probably don't know what plan is right for you, because even once you choose a supplement or an advantage, there's still hundreds of plans in both of those vehicles that you can choose from. So now here's my free offer to you to help you get started in the world of Medicare. This is my free, no strings attached solution. So whether you're turning 65 or you are over 65 and you already have a Medicare plan, and you have any one of these problems, like premiums are too high, you have a large procedure coming soon, you have no dental, vision, or hearing coverage, you have no customer service to talk to, you're in the Part D donut hole, you're not drawing Social Security, you're drowning in paperwork, your income is drastically changing, you have limited income, so on and so forth. You can pause this and read them if you want. I want to offer you a free personalized 3-plan report. So with this report, I will actually find 3 plans that I think are most suitable for you based on your needs. I will actually provide professional analysis by myself, a licensed insurance broker, and I'll even give you an annual cost estimation based on your doctors, your drugs, your pharmacy, and more, so you can kind of see how the costs may play out over the year. So why would I offer this for free with no obligations? Well, to put it plainly, I only think that you should work with people in insurance or finance who you trust. So my only goal with this is to help build your trust and show you how I might be able to help. Worst case scenario, you recycle a few pieces of paper or delete my email and never talk to me again. Best case scenario, I could help you save hundreds, if not thousands of dollars in 2024. So let's say you see your 3-plan report that I make and you like it and you want to try something out or just even talk more about it. If you do decide to work with me, number one, there are no fees at all for my service, and you would pay the same price whether you were to go to me or directly to the insurance company. Since I'm a broker, I can shop from multiple A-list providers to make sure that it's actually the right plan for you and not just one that I'm commissioned to sell. And number 3, you'll get in-person year-round service. This can be face-to-face, this can be on the phone, however you prefer. So now your final big question is probably, how does Braden make money off this if there's no fee for the service? And it's actually a pretty cool little setup. So let's say without me, you decided to just give your money to the insurance company in return for their services. They would keep all your money and you would probably get some poor service because their job is to make algorithms and move money, and they have call centers, but you'll usually be on hold for hours. So now let's say you worked with me. So you still give the same amount of money to the insurance company. However, you're getting great service with me and we're building a relationship. and I know you, I know your family, and I know the needs that you have. And the insurance company is mandated by the government to actually provide me with a compensation for helping facilitate your plan and basically service you. So I hope that helped. I hope you were able to learn something about Medicare. I strongly encourage you to get one of my 3 plan reports. Again, it's free. There's no obligations to work with me, but I want to build trust with you and show you how I can help. If you'd rather just call me and just straight up talk on the phone, there's a button to do that as well. So either way, I look forward to hearing from you, and I will see you soon. Thanks.